Now, I would like to ask the Deputy of Minister of Mental Health of the Ministry of Health, Mrs. Ζωή Ράπτη, to address the audience.
Your Excellencies, dear colleagues, professors, esteemed professors, ladies and gentlemen, I would like to welcome you all to today's event, Mental Health in an Unequal World, that is co-hosted by the Ministry of Health and the Society of Preventive Psychiatry. And thank you all for your participation in this meeting. It is a great honor to discuss with you the crucial matters of mental health, especially during these unprecedented times of the COVID-19 pandemic. This pandemic has brought significant effects on people's lives, especially shining on mental health. This year's theme for World Mental Health Day is Mental Health in an Unequal World. Racial, ethnic, economic, and ideological discrimination has always been a burden to mental health and an obstacle to effective and wholesome provision of mental health services. The efforts for mental health policies is actually an effort to support human rights. COVID-19 had a significant impact on mental health systems, as we all know, and that is resulting in many people with mental health illnesses not receiving the proper treatment they deserve and continuing to experience stigma and discrimination. At an early stage of the pandemic, Prime Minister Kyriakos foresaw the need to focus on improving the general population's resilience and created a special portfolio for mental health and addiction in Greece. This was being done for the first time. Since the beginning of the pandemic, the Ministry of Health, in alignment with WHO's principle, leave no one behind, has taken a series of steps to address the needs of the general population with a focus on the most vulnerable groups. Among others, we increased public funding for mental health by 62%, which is something which was important and needed in Greece. And for the first time, the funding of the social cooperatives for mental health was included in the regular budget of the Ministry of Health, ensuring the right of the mentally ill to reintegration in the society. We are providing also psychosocial support to adults, children, and adolescents across the country, including our isolated areas, mountainous areas, and the islands, through hotlines, through telepsychiatric services, and through digital tools. We are also developing mental health facilities in the community, such as residential families facilities, nursing homes, mobile units, and day centers for the psychosocial support of different target groups across the country, with a focus on children, adolescents, and the elderly, which were most affected of these categories by COVID-19. Early intervention services in psychosis were legislated for the first time in Greece last December and now are under development. We also operate addiction prevention centers throughout the country and a digital map so that the citizens can identify all the available mental health services they need near their community. We create also collaborations and synergies which are of vital importance to us with national and global actors and organizations such as WHO, Europe, UNICEF, and other ministries and local authorities. And that is why, in collaboration with WHO Europe, the Greek Ministry of Health recently conducted a joint review of the current state of the mental health services in Greece to improve our mental health system. This joint review led to the creation of a National Committee for Mental Health, which will work and draw the National Action Plan for Mental Health for the next decade. We will be focusing on protecting the rights of mentally ill patients. Also, in collaboration with WHO Europe, we convened in Athens after it was the first live Congress, the Athens Mental Health Summit, as we call it, in July, and the summit led to the Athens Mental Health Declaration, which is recognized as a stepping stone for the adoption of the European Framework of Action for Mental Health 2021-2025 of WHO and the launch of the Pan-European Mental Health Coalition. Last week in Brussels, I had the honor to actively participate at this launch of the Pan-European Mental Health Coalition by the WHO Regional Director, Dr. Kluge, in the presence of Her Majesty the Queen, Matilda of the Belgians, and the EU Commissioner for Health and Food Safety, Mrs. Kyriakides. National and international collaborations are the surest path for change and real progress in the provision of mental health services in our regions and the globe. Our vision is to shape our mental health network so everyone can achieve optimal health through equal access to people and community-centered quality services with zero tolerance to any exclusion. Thank you very much for the invitation and the joy to be addressing such an important audience.